Well, we're back right here in the studio, and we have with us right now our guest, Dr. Fatimah Alansari. Dr. Fatimah is a cardiac rehabilitation specialist. Dr. Fatimah, welcome to our program, Hala Kuwait.
Thank you, Tariq. It's nice to be here.
Pleasure to have you with us. First off, we want to ask you, what exactly is cardiac rehabilitation, and what does it include?
Well, cardiac rehabilitation is actually an intervention, you can call it, or a program or a course that includes exercise training, nutrition, counseling, and education about exercise, physical activity, helping patients to get back into their healthy lifestyle by quitting smoking, managing their weight, and following up on any risk factors that they have.
Excellent.
Like high cholesterol and blood pressure. And
Great to hear that, doctor. So how is rehabilitation, let's say, different from regular medical treatment? Explain the difference between that, please.
Well, medical treatment is usually managed and looked after by physicians, by cardiologists, and includes medical procedures, medication, surgeries, of course. But rehabilitation focuses on restoring a patient's function, physical activity, any disabilities that could cause and interfere with the patient's quality of life.
So tell us now, I know after heart attack or surgery, rehab is very important right away.
Yes.
So how is it rehab is important like that? Tell us more in detail.
Well, rehab is very important. It starts from the hospital.
Yes.
When patients are admitted, after finding out if they have any cardiac disease or if they've been if they had a cardiac surgery or a procedure. So mobilization is very important whenever the doctors clear the patient that they are safe and okay to start doing their exercises, whether it's bed exercises, whether it's walking, because cardiac rehab is a journey. It has different phases, and the phases progress after time. So it's very important to promote physical activity and progress and monitor these patients.
Excellent.
Yes.
Good to hear that. So rehab, I think, Dr. Fatimah, lowers the risk of future heart problems. Is that correct?
Definitely, yes, it does, because it's a prescribed, it's a medically prescribed and supervised program. So a lot of healthcare professionals, because it's a multidisciplinary team effort, so all the healthcare professionals, including cardiologists, physical therapists, such as myself, pharmacists who are specialized in cardiac cardiovascular medication, nutritionists, exactly, and psychologists.
Excellent.
We all work together to improve the patient's health.
Overall well-being.
Exactly, and specifically their hearts. Yes.
So, Dr. Fatimah, how does education, exercise work together in this program?
Well, education is very important. We educate the patient about the benefits of exercise, mentally, emotionally, physically, and how they, and a lot of strategies. We teach them what to do at home, starting from waking up till the end of their day and throughout their lives. It could also include any competitive sports if they are interested or if they're athletes, or they can just maintain a certain level, especially if they are older patients, but keep them active while, of course, supervising and offering the other counseling from other health professionals.
Okay, that's very good information. We're going to continue with our interview with our distinguished guest, Dr. Fatimah. But first off, we're going to take a look at this report. Stay tuned. Well, we're back right here in the studio, and if you're just tuning in, our guest is Dr. Fatimah Alansari, cardiac rehabilitation specialist. And Dr. Fatimah, before we went to that break, we appreciate your valuable insight and information on this subject. So how important is emotional and social support during recovery? Tell us about that, please.
It's very highly important to be emotionally and supporting these patients, because they're very fragile. They have they suffer
they're
from
at a weak point in their life, and they need the family support.
Definitely, you would have patients who are in shock because of having a cardiac problem, especially if they are athletic, or they are living a healthy, active lifestyle, or they have depression because of course, the medication, or anxiety of being physically active after having these cardiac problems. So they do get into depression. Now, I always say that depression leads to less physical activity, and vice versa. If you are less active, you will get into the depression and anxiety. So it's a cycle. So we need to help the patients, give them a lot of support, and encourage them even after they are done with the program, with the course of their cardiac rehab.
So now let's say each patient, do you do an assessment for each patient? Does the program change depending on each patient's needs?
Oh, absolutely, absolutely.
Tell us about that, please.
Well, because you would have patients who are young, even in their 20s, in their 30s, and you have older patients. And of course, you have different kind of patients, such as men and women. Patients who are educated, patients who are less educated, patients who are more active, especially with their jobs, who have a lot of physical demands with their jobs, and patients who are less active. So it's tailored, it's individualized. We look at each patient with our assessment and evaluation, what each patient needs. And of course, according to their goals, whether it's a medical goal or their own personal goals that they need to achieve.
Okay, it's very important, these things.
Definitely.
So you often meet with the patients at many different stages to see what they need? Tell us more.
Oh, yes, definitely. The first visit, whether it's at the hospital or at the clinic, I sit with the patients for a long time, and it's sort of like investigating with them and going very deep with them and asking about their physical activity. What do they eat? Any social support? What do they do throughout their days? What is the type of job they work? Or even if they were retired, I would ask them the history, what they used to do. So it's very, very comprehensive. And then if the patient needs, of course, nutritional counseling, psychological support.
A whole support team, multidisciplinary, like
even
you
with
said.
their medication, if there's sometimes they would think of something that they forgot to ask their doctor,
yes.
They would ask me, so I would say, okay, let's put that on hold, and I'll discuss it with your doctor. And I've done that a lot, and so we discuss, and we for instance,
come up with the right plan.
Yes, for instance, a lot of patients come and they will find out that their blood pressure has been low because probably they didn't go back to the doctor, they didn't follow up for a long time. So it's a great way to have that conversation in everything, including all these components of the cardiac rehab is included. But the first visit is very important. It's very holistic.
So who benefits the most from cardiac rehabilitation?
All patients benefit, all cardiac patients, whether they had they were diagnosed with a cardiac disease, or they had a cardiac procedure, or they had a cardiac surgery. Even patients with a heart transplant, chronic heart failure, patients at the very last stages. And even patients who are not yet diagnosed with a cardiac disease, patients who are at high risk, such as patients who have a family history, patients who are obese, patients who are diabetic. It's very important to include these patients because, as you know, Tariq, research has shown diabetes is linked to cardiac diseases and vice versa. So we look into all these cases to help them.
Do we have a large amount of cases in Kuwait of people with cardiac problems, right?
Oh, yes.
Prevalence
yes,
of smoking, I think obesity, play a role, right?
But I think patients in Kuwait have, their awareness has been raised. They've been much more educated now, a lot in the media, the campaigns, of course the social media specialists. Plays a role. People who have access to any sorts of, or just simply a patient who walks into the clinic and we can help them at the cardiology clinic.
Excellent. So do these patients, let's say, who have these problems, who walk in and so forth, do they need their cardiologist's approval before starting?
Yes, definitely, to ensure their safety, of course. If they could start with their structured exercise training.
See if it's safe for them, right?
Definitely, but in general, cardiac rehab, I would always assure patients because they think it's an intense exercise program. And I always have to mention, it's not a marathon running training program.
At a pace.
It's very gentle, very light. If you'd like to build it up, we could help you and supervise you, but of course not to extreme, not to exhaust the heart. And we monitor with different exercise tests, such as the stress test or the cardiopulmonary exercise testing, or also looking into the patient's vital signs, which I definitely teach patients how to look at their vital signs at home and teach them how to write a diary to keep up with their vital signs.
Okay, that's good. It helps you when they have a diary too,
definitely,
right?
for those forgetful patients.
Sure, sure.
Yes.
So how do you measure a patient's progress in the program? How do you see they've made steps forward, getting better? Tell our audience about that.
Of course, with the intensity, we look at the patient's intensity, and then, as I mentioned earlier, with the exercise stress test, if they need the cardiopulmonary exercise testing, or just with the time, the distance, the steps, we can do all sorts of monitoring, looking into the patient's progress and seeing if they are getting better. And of course, if they need to rest, they can take a lot of time to rest, because actually the cardiac rehab session is a long, the time itself takes from 45 minutes
to quite a long one.
Till sometimes an hour and a half.
Okay.
So I let my patients take their time, especially with older patients who come in with the wheelchair. They need a lot of time to get up and move around in the medical gym at the hospital.
Okay,
Yes.
so tell us about that. There's a medical gym where they can do some different exercises that are requested?
Yes, definitely. We have a Jabber, a medical gym, where the patients are referred. I work at the medical gym and, of course, at the cardiology clinic along with my fellow cardiologists, where they refer the patients to me, and I look at the patients, evaluate them and assess them, and then we refer them to the gym, where I also supervise.
Well, great. You must
exercise.
have your hands full with all of these different roles that you're doing.
I do, yes.
You're well known to be a very hard-working, dedicated person to your job,
Thank you,
which I'm sure you're doing with the team members there. It's, I'm sure, very demanding, and cardiac problems can get worse without any of these things, correct?
Yes, definitely. But I do love encouraging my patients. I love the mental health aspect of it. I love to keep them happy as long as they are physically active, and just that, I would be happy with that.
Okay, great to hear that. So what lifestyle changes like diet or stress control are usually encouraged along with rehab? Tell us about that in depth, please.
Well, because of course I am a cardiac rehab specialist. I have a master's degree and PhD. So naturally I would have to have a lot of knowledge about nutrition. But I am not a nutritionist. But I do help them, and we talk about their nutrition. If there is something specific that they need, for instance, if they found out something with their blood test, or the doctor had some sort of concerns, definitely they will be referred to a nutritionist for counseling. The stress issue is the same thing. Either if they need intensive therapy with a psychologist or a psychiatrist, or I could just encourage them with the follow-up, because I do have a special number that I contact my patients with, and I do follow-ups with them from time to time, and I send them messages, encouraging messages, just to foster that.
Sure.
That
to keep them going and motivated
keep them going
to stay in good health.
Yes, definitely, yeah.
So how long would it take, let's say, for a patient, I'm sure it varies, of course, from patient, to get back to their normal lives and routines, Dr. Fatimah?
Well, it depends on the severity of the case, of course, whether it's a disease, a cardiac disease, or a surgery. But usually, I would tell the patients, don't let anything stop and be in your way. Whenever the doctor has or decided that you are okay to be physically active and start with your exercises, they can return back. So normally, let's say for work, they would return back, again, depending on their physical demands, according to their jobs. They could go back to work within a month if they need supervision or not, even at work. If they want to go out to the gym, to walk in parks, to travel, to socialize with their patients, even with their during their intimate time with their spouses. So we look into all these things, but with supervision. It's very important to keep our patients safe and happy.
Well, Dr. Fatimah, it's a pleasure to have you on our program, Hala Kuwait. Do you have any last words or comments for the audience watching tonight's program?
I would just say, just make sure you live a healthy life, exercise, be physically active, watch your weight. You never know when, and we are always here to help. Cardiac rehabilitation program is a comprehensive program, and we will look into any problem that you would have. We will gladly help you.
Thank you so much, Dr. Fatimah.
Thank you. Thank you, Tariq. It's been a pleasure.
Thank you. We'd like to thank our distinguished guest, Dr. Fatimah Alansari, a well-known cardiac rehabilitation specialist right here in the state of Kuwait, for her time with us tonight right here on the program. Right now we're going to move on to another one of our amazing reports this evening, so stay tuned.